This is Jeff Clark from GoldenCare USA. I want to thank everyone, first of all, for coming on to listen to Bob Pearson about the CareOptions program. Really, just an outstanding program, an extra benefit that we offer to our agents that you can offer to your clients. And Bob will explain more of this, how you can kind of personalize it to make it look like it's your website, put your information on there, steer your clients to a great benefit they can use. We sometimes use it as a carrot to set appointments that will allow our clients to have access to CareOptions if they've set an appointment with us. So we use it in a variety of ways that Bob will speak to, but Bob's the founder and really the lifeblood of CareOptions. He's passionate about it. He knows the product obviously inside out, and he'll go through a lot of it and how it benefits you and how you can use it to increase your sales or increase your appointments, etc. And without further ado here, I'm going to turn you over to Bob Pearson. And Bob, I want to thank you again for taking the time to do this for us, and thank everyone for coming on board. I'll go ahead and put my phone on mute, and I'll turn this over to Bob. Thank you, Bob.
Thank you, and thank you, GoldenCare, for giving us the opportunity to work with you and your agents. Yes, CareOptions is exciting. There's multiple ways that you can use it and work with it. What I'm going to show you today is just get down more into some of the benefits that you don't see when you just kind of scroll through it. So I'll dig a little deeper, show you a few more benefits. I mean, we could spend easily an hour going through a lot of them. I know a lot of people have questions at the end. If we can't answer them all, don't hesitate to contact us directly or talk to Jeff or John, and certainly we can work through it with you, even kind of go online and maybe show you some more technical aspects of it, so you're better able to explain it to your clients, whether they be individuals or groups. And we've had a lot of success with both. First of all, just to kind of explain and I'm sorry about this, I'm using a PDF instead of a PowerPoint here. Let me just get this straightened so you can see it. Okay, just to kind of explain the platform that it operates on. CareOptions, not a typical website. It's software operated in the cloud and delivered to you and your customers over the internet. So, a lot of times you go, oh, it's another website. Well, yeah, delivered that same way. But in the background, it doesn't operate the same way as what you'd think of a typical website. There's two platforms, two categories it works with. Software as a service, SaaS, which is software licensing. Delivery model is on a subscription basis. As you know, you apply or put your member in. And again, GoldenCare is taking care of that for you, which is great. It's centrally hosted, sometimes referred to as on-demand software. And today that's happening with a lot of things. Now you can get Word or get Outlook, and you go online, and it's software as a service. You don't really have it on your the second part is it's platform as a service, which is a category of cloud computing that provides a platform allowing customers to manage applications without the complexity of having to build and maintain the infrastructure as we do. So that's very unique, and I'll show you why as we get into it. CareOptions was derived from our EAP. We basically follow rules of employee assistance programs as to confidentiality, things like that. The way it operates, the way that we generate utilization, and so on. But even though it's an EAP in that sense, we work with individual association members, employees, employers. So it doesn't limit. As all of us know, there are two certain things in life, aside from death and taxes, healthcare and aging, and I'm sure that's why you're in this market. And it really is a great market. And I know you've got AAP coming up, and that keeps you busy along with a lot of other areas in the senior market, which is growing rapidly. Again, if there's one thing that everybody has a need for, it's healthcare, and everybody has in common, it's aging and healthcare. So CareOptions tries to address both, obviously. And the best part is it's available anywhere to anyone 24/7. It's a value-based, as you should look at this, it's a value-based competent marketing strategy. That's how you're using it. You could call it added value. You're modifying your value proposition, all of those old phrases. But basically what you're doing is you're offering something very unique, a very unique service when they do business with you, or even if they're a prospect of yours that you hope to do business with in the future. It'll keep your name in front of them. And that's the branding side of this, which is very effective. Whether they even go on it or use it, they're getting that email as long as their email address stays valid. So that continues to put your idea or your brand in their mind up front and center. What the value-based in the competent marketing strategy means is you communicate competency. You're giving them something. You continue to impress upon your customers, your prospects, that you must provide them with something sustainable that helps solve their problem. Not an umbrella or, something that another calendar, but it offers education, provides relevant, up-to-date resources and information, something that extends to them a unique competence and expertise on a continuing basis. And that's what it really is. And that's what we provide here, and it's an award-winning program, matter of fact. It's the most useful and powerful tool of its kind, designed to help individuals and families identify healthcare cost safety issues before they become unmanageable. And that's really about detection and prevention. CareOptions, it contains resources, solutions that can save people time, and really thousands of dollars in many cases. In addition, it's the most comprehensive knowledge base of care resources for growing issues. Nearly 70% of us, of course, will eventually be required to, if we look at caregiving, to provide some form of it. And the average caregiver lives an average of 480 miles from the people they care for. So when you're helping somebody with resources, how do you save time? How do you communicate that? How do you get involved without flying back and forth or driving back and forth halfway across the country sometimes? Anyway, the content itself and the system itself, we rank top in many of the contests that we go into, and also the ranking services that do a lot of comparisons. And what it is our content, it's not so much stuff to read. There's not a lot of articles to read. You can find those all over the internet. What they are is very useful things that are what people need, not just a load of stuff built into the system. We also took first place gold in the Workplace Solutions. That was the 26th Annual National Mature Media Award. So it really does what it says it does. But again, you got to use it. You got to promote it to the people. If you just say, here you go, I'll activate it, look for an email, well, they don't know what they're getting. They may not even open your email, even if it comes and it tells them a little bit about it. It's not just something that, you put a bunch of names in and they get an email and you hope they understand it and use it. You've got to let them know a little bit up front. It's money saving. It's interactive, and we've got over 2.5 million care resources and providers all in one place. There's no ads. There's nothing to buy. It's completely unbiased information and resources. It underscores the importance of whatever insurance that you're selling or you're marketing, and it provides money-saving solutions to issues related to financial security and personal well-being. At one time years ago, when we were selling it for $225 membership a year, it was moving them. But over time, people tend to think, well, everything on the internet's free, and so you've got to build value. But what you're doing is you're not charging them for it. You're better off just giving it to them, and that works. And there's no charge for the entire family. The knowledge base, again, it includes physicians, hospitals, clinics, healthcare facilities, assisted living, in-home care, homemakers, pet sitting, and other resources. So the key here is it's all in one place. Quality of care, that comes up a lot. With hospitals, we track a number of ratings, and it's fun, too, to go in and just see how your hospital's doing. You can find out now on a rating system what your specific hospital, how many diseases people are walking out of the hospital with that they didn't have coming in. That's a very unique rating, and that's one of the newer ones, along with surveys from other patients. So you can get an idea of the quality of that hospital. Not that you always have a choice, obviously, of the hospital you're going into. You can find physicians, assisted living, and certainly nursing homes with the complete background in some of our own rating methodology. You can create reports. At one time, we were selling those reports. And again, those are unlimited. How do members save money? Create advanced directives. These aren't just the ones you fill out in the doctor's office. These are very specific, and they print out, and they're all legal binding when they're executed properly. And every state's a little different. So when you put your information in, you put your state in, it's going to kick out the appropriate document. You fill it out online, so you don't need a pen. You just do it right there. It saves it for you and automatically in the file cabinet. So you don't have to hit save every time you go through a page of it. It just does it automatically. So it's always there for you. You can also create the healthcare power of attorney documents and document sets. Again, that's saved in the system. You can create a caregiver agreement, which has become very popular. What it is a template that they can take to their attorney, saves them a lot of money because they don't have to start from scratch. But an attorney does have to add the language for that specific state, especially if you're looking for some form of tax advantage from it. Our Care Alert medical emergency notification, it's unique too in the way that it takes the information and delivers information. Cost calculators or cost evaluators, cost of care, and I'll be showing you that when I get in there, and you can find out cost of care in any area. And then you can create a cost of care situation with nursing home, home care, and go through it, and I'll show you that. And again, our interactive care guide function, that was developed by our care managers. We used to do this manually. You'd call in. It was telephonically engaged. You'd talk to a social worker. She'd go through all this information, and she would actually create a care plan, or a care guide, I should say. And all of the information's in it. Well, you can do that in here, and it saves it for you. Families can share it. They can log on, and get into your account if you allow them to do so, and share the information. Members can learn how to save money when they need care from a provider. We just give you helpful information on what to say and really what to expect when you're going in there and trying to negotiate with assisted living or even a nursing home, especially on a private pay basis. So it's intuitive, interactive, it's money-saving, it's award-winning. Okay, with that, what I'm going to do is just move into the system itself and give you an example here. Let me just get that. We can get rid of that one, I think. All right. Now, once the way that your customer, or the way that you would receive, you send right now, I think the way you have it worked out is you have a name and an email of a prospect, whether it's a prospect or a customer. First, as an agent of GoldenCare, you have to register with GoldenCare. So you have to get a hold of John, or I think Sarah handles that, and give them your name and address and phone number, and they'll create a profile in the CareOptions system for you. Once they create that profile, they'll be able to, when you send them or when you activate a prospect or a customer in the system, this way your name will be on the letters, the monthly letter that goes out, which I'll show you, and also the welcome letter that goes out initially, which gives them their access passcode and other information to help them understand what it is. At any time, I mean, they log into careoptions.net, and once they get that code, they enter it in this box. Or, and let me just pull up what they get when you submit the client's name or the prospect's name and email. They'll get this email. This is just an example. I took it from Todd Anderson's account. And they would get this, and again, it's from you, and it has the information along with their access code. And down here it gives the access code again. Now they can click on this bar, it says check out my benefit, and it'll just take them right there. So they don't have to actually enter CareOptions and then enter their passcode. If they click on that bar, they should probably keep the email. They'll always have the passcode. If they're using a Google browser, it'll ask them to memorize, do you want us to keep the passcode? And you would say yes. So this is the letter that goes out within seconds of entering your prospect's name and email. And again, it comes from you, and it's personalized to them. Once they have that, they either go here and enter it, or it just opens if they click on that bar on their letter. This is what we call the Launchpad, CareOptions Launchpad. It's an award-winning user interface, meaning it's easy to use and understand, because unlike general websites that have all those confusing pull-down tabs that cascade down to more tabs, more links, CareOptions developed this graphical interface so that people can associate their thoughts with the pictures on the icons, images, but also hover over and get a brief description of what each application does. So they don't have to click on each app to find out. And that becomes very useful. Also, we categorize each section. Now, even though I call them apps, you can't slide them off to your phone. Now, you can open this up on an iPad. It's optimized for an iPad. iPhones, depending on the size. Now, iPhones are getting better, or phablet phones, I call them, whether they're Android or whether they're, an Apple. It'll open on, anything, literally, as long as it has a browser. Okay, now if you're browsing or if you're going over to see what each one does, you can also just go up to the book here. You can just click on this and view the directory. So you can go through and see everything that's in there. And it's always good to do that. This mouse isn't working right. It's always good to do that because once you become familiar with it, you have a thought or something's going on that day, and you'll think of it, and that's the hardest part. And that's why we do the monthly e-letters that go out to each one of your prospects, again, from you with your contact information on it. Notice, too, on the top of every page is your contact information. It'll be your name, your email, and whatever phone number you use or you give to Sarah to put into the system. That'll show up on everything this system does. Every letter that goes out to every prospect or customer you have will have your information on it. Just to go through, over here, what's new, this will show you new applications, or the newest ones in the system. There are a couple of videos, whether you're retired or working age adult. More information. This will take you and give back your background information and your contact information. Again, it's up on top of each page in addition. User guide, if you think you need that, it's good to use, especially if you're going to look at making a care guide. It'll help you and kind of shorten up the time it takes to do it. And the App Store, which I'll show you in a minute. Up here is the gear. The gear is pretty important. Again, your member password, all of your information's here. This is where hopefully, and they don't all do it, their email changes. They forget to go in here and change it. Well, if they do that, the system doesn't know, and it's going to be sending off their monthly e-letter into space. So, it's important to try to maintain that separately or on your own with your clients just to make sure you have their up-to-date email address. On each one, they can cut out a card. Your name's on the membership card along, again, with your personal contact information. So they're free to open that up and fill that out. The on and off is just for the hovering, if you don't want the information to show up. Then App Store. Now, what you have is you have categories of apps just to make it easier. you can move the apps around within the category, and every client you have or any user you have on here, it'll stay within that setup that you create. So every time they log on, it'll be where they left it. Now, we've got about 66 apps, 30 primary, and we've got about 36 in the App Store. And I'll just open the App Store. Doesn't cost you anything. They're free. A lot of them are links, like to the Social Security Retirement Estimator or Health Reform or healthcare.gov or, different directories that it wouldn't make sense for us to duplicate. And what you simply do is you drag them down into out of the App Store onto your user interface, and then you just close the App Store, and then they appear in your user selected apps. So they'll always remain there until you take them out. So you can personalize what you use or what you might be using at any given time. Now let me show you some of the unique applications as we try to buzz along here, because I know we never have enough time, or I don't have enough time. Create a living will. Let's take a look at that real quick. That's a real popular one. We have to go into the file cabinet. This is where you create a file cabinet. And once you do that, all of your information that you do on here is automatically stored. You can't upload stuff. There's some HIP issues and stuff, so we don't allow people to upload their own documents into something like this. But we keep certain ones in that you create on here. So I can continue to work on this advanced directive, or I can go to the file cabinet and see what I have in there. I got quite a few things. You can make as many care guides, care alerts, advanced directives as you'd like. Now what we'll do is we'll just we'll use this one. We'll go in like we were editing it. And basically it just, real simple, asks you all the pertinent questions and more. It also gives you an area you can type in other directions. Also here you create your power of attorney designations, indicate everything, and then you finish it. When you finish it, it'll turn it into a nice PDF document package, and this is automatically stored in that file cabinet. So you can go in, you can update it, you can you have to print it out the first time because you've got to execute it according to the state, and it'll be appropriate for the state because you put the state in. So you fill it out, you put it in a place, you store it there. Now what you did too is you indicated here where you have the executed copy stored before you finished it. And this way it tells somebody where they can find it, or the executed one. This way you can actually email these out to your doctor and family members, again, knowing they know where the executed one is if they need the signed copy. So it's pretty slick, pretty easy, and again, the whole family can do these. Now let's just move on. Home safety is a popular one. Again, this is saved when you create it. You go through, you answer the questions. It's interactive like a lot of the assessments in here. This is just one of the more important ones. Mom or dad can do it, or you can do it on their behalf, or you can do it for your own home. You submit it, and these are the primary reasons for people having accidents in the home. And what it does is gives you a response and then the recommendations, which always seem common sense, but it's funny until somebody does this, they're not really taking it seriously enough. And this way you can go through and you can make that home a lot safer, or apartment, and rest assured that you've done something to assist. So that is also saved. And also in our Well Check 6, there's a whole package of different assessments you can walk through, or your parents can do, or you can do. Let's look at some of the resources, and let's go right over to hospitals and clinics. And I mentioned that earlier. I'm still in a zip, but that's okay. So let's look at hospitals. Okay. And we can look up a hospital by name also within that area. And let's just look up, I guess any one of these. More info. Okay, this one, they all come up, the maps come up right on the page. You can do a street view, an overview, or directions. You don't have to take it outside. Here is the hospital-acquired condition. This is one of the newest ones. What it is, with the higher number indicating that the hospital has a greater rate of patient harm, infection, or condition arising as a direct result from their stay, not something they walked in with. So obviously, the lower the better. Now, this particular one is under the averages for the state of Wisconsin and the U.S. That's probably as best we can ask. And again, that's one you do want to look at. The rest, these are just some price comparisons. Not that it matters if that's you self-paying. But the surveys are important. And these are probably the best way today to really identify hospital. And CMS does the surveys. We get all their survey information, then we set it up. And it's a good way to find out what to expect in that hospital. And I think that's what more and more people are looking for. So that's just a quick overview of the hospital, and all the information is in there, from number of beds, what type of beds, so on and so forth. If we go back, and care facilities always come up, and again, we have them all, as you can see them listed, but the one that's always of concern, of course, are nursing homes. So we'll go up, we'll click on nursing home, we'll do it in the same zip, and we'll take a peek, and we can set the range, things like that. We include the star rating. That's actually Medicare's star rating that we transposed over here. So it gives you an idea, but we have another rating system in here too that's real helpful. So here's a 3-star rating. Again, it gives you the type of nursing home it is, a little bit of the demos, it gives you the map. Then we have all the inspection results right here. We also do a range of comparative quality based on the number of deficiencies in average. And this one's got a high number of deficiencies over the average in this area for a period of time. You can find out what those are. We have the descriptions. But you can open up all the health inspections and see what they were. Or you can go down, you can see the fire inspections. Again, those are probably one of the more important ones. And up here, you can look up penalties, if there's any financial penalties that have been made, or all penalties, and they've been fined a couple of times. Staffing ratios, that always tells you something. And resident info. So there's more than you probably want sometimes, but it sets you on the right course, and nobody should choose a nursing home just from this alone. The idea is to visit it and certainly talk to other patients if you can. So that's one of the things. We get into physicians, all the physicians throughout the U.S. You can pick them by location, by occupation, by specialty. Conversations with elderly, that's a very helpful form. All of our different assessments, I would go through that when you do this, or when you get signed up if you're not already, go through it. And also our medical resource, which is a lot easier to use than WebMD, and it explains it a lot better. It's all in the system. Then the medication list. This is one of our newer systems. And one of the things people forget about, and again, whether you're much older or, or younger, if you're taking meds, even over-the-counter supplements, you want to keep a list of them. And one of the problems that we found in the past, somebody had to print out a piece of paper and then write on it. So we created a dynamic form, a PDF. You can save it on your hard drive. You can't save it, won't save to the hard drive in the system. But you can fill this form out and take it to the doctor and give it to the pharmacist. Really important, and you can, fill out a number of them depending. But at least you can fill it out online and then print it out. It'll save everything, save it to your documents, or print it or email it, however you want to do it. And it's a great way and a great tool to make sure your prospects know is available there, your customers, because they might be doing it, but not really in a good organized fashion. So that comes in really handy. And I think I'm not sure how much time I have here, but I noticed I'm at 2:33. So I'm going to show you one other thing. I mentioned a monthly letter that goes out here. And let me just pull that up. And every month we pick a topic or a feature inside CareOptions, and we send it out from you to all of your prospects. By the way, you can submit your picture. And when your picture's submitted, she puts it in the system. It'll show up on your letters, and it'll show up on the website itself next to your branded information. So that's up to you. And what this does is just remind them once a month, no more. It doesn't sell them anything. It's a quick blurb about a specific topic. This one was about a list of services so they understand what's in it. Next month we might be talking about, hospital quality of care. And again, it'll direct them right to that feature within the CareOptions system. So that's how it's done. And it's really, really unique, and the branding's good, and the value is great. One other thing I'm going to show you is what we call the quick pass. Now, John, I haven't showed you this, or Jeff, or Sarah. This is something new. In the past, you had to call in or send an email to GoldenCare with your client's name or prospect's name, and email and say, activate a membership for these people. Now what will happen is GoldenCare will be able to, Sarah, Jeff, John, will be able to give you what's called a quick pass code and a quick pass link. What happens is you can even put that on your mobile device, that link, and you can have your cell phone while you're sitting with your prospect, put in their name, put in their email, hit activate. While you're sitting there, your prospect or client will get the activation email that I showed you earlier. This. So it'll happen immediately. Or you go home and you do it. Or you do it on your iPad or on your computer. So that link will be available, and it's unique to your account. So that person will automatically go into your account. And again, it'll be all your branding, all your information that's sent to them. And also, this is what we call a universal code. If you don't have that link, but you have your universal code, you just go online, go to a web browser, go to careoptions.net, put that code in there, and anytime you do that, just like the Quick Pass, this is what opens up. So it says activate your free service provided by, in this case, Todd Anderson. I'm using his account. And you put your client's first name, last name, email address, hit activate. I would always activate my own clients. Don't give them your universal code that opens up this box, because they'll never do it. It'll go, they'll put it in their pocket. They'll never get around doing it. It's real important that you do it for them. So get their email, get their name, put it in the system. Now you'll have an easy way to do it. Any questions? And I guess I got to hit star 5. Oh, wrong star. Hello. Are we in?
Thanks, Bob. Yeah,
The
I can
conference
hear
is
you.
now in talk mode.
Oh, okay, there we go. Any questions?
Yeah, I have a question. First thing that occurred to me is I've got a lot of information in here. What do you do to keep hackers out?
Well, it's all secure. I mean, we don't put our database in the cloud. It's 256-bit encryption, and that's about the best we can do. And again, what they're going to get, if somebody did hack it, it's never been hacked because it's not, I don't know who would be interested, but everything gets hacked these days, it seems. They get a name and an email address. You can buy those lists. So there's nothing else associated with that name and email.
Do they get a full explanation like you've just given us? Or do they just have to dig into it themselves.
They got to pretty much dig in and depend on, there is some point of sale material that we can give you that kind of walks through it. And we're always working on more videos. That's why I would say what you can do is these videos, these two, they're older videos, but we've never updated them because they're pretty much still right on. And I would go in and play these, and we can give those to you. I can get the links and get them to John and Jeff and Sarah on the YouTube links. I'm not sure what the YouTube link is, but those are out there. Let's see. Oh, yeah, this is on YouTube. So you can open it up, and you can get the link, which is right there. Just open it up, get the YouTube link. If you don't know how to do what I just did, just contact us, and we'll give you the links. But that would be a good way to show them that they could play it. It's a couple of minutes, and get an idea as I shared with you. And what's neat is the video gives it gives examples rather than just me going through showing you, hitting buttons and showing you what's under it. So that's a good way to do it.
Jeff, can I add one thing?
Go ahead.
Can you hear me, Jeff?
Yeah.
This is John from GoldenCare, and I do want to tell you all, take action and get involved with this thing and check it out yourself. We have very few agents who are really using it, but they are by far our most successful agents. They've landed groups and sold hundreds of thousands a year off this program alone. And if you look at everything it can do and then just start imagining the people and the groups and the workplaces you can give it to get leads, you'll get hundreds of leads more than you've ever had with this tool alone. And Bob can attest for how many different groups we've given this to in the past.
Oh, yeah.
And the millions and millions and millions of dollars in sales we've made out of it. So.
And that's because you're providing them with something more than an insurance policy. You're giving them something they can use today that helps them with the topics that you're talking about.
Exactly.
All right. Well, thank you, GoldenCare. Appreciate it. Thank all of you for attending.